Namaskar. Welcome to another episode of What Does This Data Say? Today I am going to talk of something different, not the usual political data. And this issue is very important to all of us. In fact, when you see the data, you will find that the successive governments over the last 20 years have done nothing about this issue. The present Modi-led government also, in the last 8 years, has only made matters worse. I will be talking about public insurance in India with a focus on health insurance. Now, under the essentials of life, food, home, clothing, and now we add being healthy also. But where do we stand in health services and health insurance in India today? Stay with me because I am going to present some very critical data on this issue which you should be aware of. So today in this episode, I am first going to present the last part which I normally do, the concluding part. But why I am doing that is because many of you don't stay to watch the full episode. So the critical part of the data I'll be presenting first because that is something that all of us should be aware of. Now in this episode I'm using the data from this wonderful report of Niti Aayog titled Health Insurance for India's Missing Middle. By missing middle it means India's middle class. This is a October 2021 report and I would suggest that all of you should download and read this. It's about 65 pages, but if you don't have the time, read the executive summary which is only about 4 or 5 pages. It will definitely help you understand the issue that I am talking of. So let me start with reading out a few points from the executive summary of this report. Firstly, expansion of health insurance or assurance coverage is a necessary step and a pathway in India's effort to achieve universal health coverage. This is a known fact. Secondly, the report says India's health sector is characterized by low government expenditure on health, high out-of-pocket expenditure, I will explain what is out-of-pocket expenditure, and low financial protection for adverse health events. India government spending on health at 1.5% of GDP is the lowest in the world. Even backward countries of Africa are spending much more than this 1.5%. Point number 3, at least 30% of our population or 40 crore individuals called the missing middle in this report are devoid of any financial protection for health. So when someone in their family gets ill, they spend all the money from their pocket, which is called out-of-pocket expenditure. At times, this out-of-pocket expenditure is also called catastrophic health expenditure. Lastly, the analysis from Brookings India based on NSSO survey shows that over 7% of India's population is pushed into poverty every year due to healthcare costs and they have no insurance, and that is the reason this happens. Just to add on that, we spend almost 2.1% of our GDP on defense or 15% of our annual budget, while on education we spend close to 2.8% of our GDP. Now let's have a look further at this out-of-pocket expenditure. Now this graph shows the out-of-pocket expenditure as a percentage of health expenditure in India, which is a national average. So if we spent in the year 2000 100 rupees on health, 72 rupees came from our pocket. The balance 28 came from either the insurance or from any other source of funding. Over the years, this has shown a very slight declining trend till the year 2012, and thereafter again the medical costs have jumped higher and went up, and now today it is around 63, which means when we spend 100 as a national average, 63 rupees, 63% goes from our pocket. Now if we compare ourselves to the world average is given here, which is almost constant at 19 and 18, which means 80% or 82% of the cost is borne either through the insurance route or by the governments themselves. In the middle income countries, today they spend about 37% out of pocket, the balance coming from the government or the insurances. The lower income countries, which are the poorest of all, there also only about 56% people spend from their pocket. Now India is even worse than that today. We are worse than the poorest nations in the world as far as health insurance is going. And lastly, just to reiterate, this is the global average, which means there are many countries where the people spend zero out of pocket expenditure. That means either the insurance or the government takes fully care of its citizens. These are countries like the United Kingdom or Germany, where they have an excellent healthcare system in place. One more excellent graph from Niti Aayog. This graph is the incidence of catastrophic and impoverishing health expenditure. Let me explain this graph to you. This is the catastrophic expenditure which one occurs in India. Now this is for 2 years, which Niti Aayog has compiled. It is for 2004, which is the light blue bars, and the dark blue bars are for 2014. Now 24% of the people in our country use up 10% of their savings. Savings means either FDs or borrowings, or they sell off something at their home to meet medical expenditure. About 13% people use up 25% of their savings for medical expenditure. 8.5% of the people use up 40% of their lifelong savings to meet a catastrophic health expenditure. Someone in their house falls ill, so they start selling off their property or their jewelry, etc. And look at the last one. 7.5% people use up entirely 100% of their saving. Now these are the people who are then pushed into the below the poverty line. They lose everything because there is no state insurance, there is no other way to meet these health expenditures, and this is a horrible statistics. Now this is a Niti Aayog report, and it's quite painful to see this data. In the end of the executive summary, Niti Aayog summarizes that there is a need to design a low-cost comprehensive health insurance product for the missing middle class. In the absence of low-cost health insurance product, the missing middle remains uncovered despite the ability to pay nominal premiums. A comprehensive product designed for this segment, improving upon the existing Arogya Sanjeevani plan and offering outpatient, that should be noted, outpatient cover, can expand health insurance coverage. Even when people are able to pay, that product doesn't exist today, so they are left to suffer. So now if any one of you does not have a health coverage, it's high time you get one, because the catastrophic health expenditure really kills us. Now I'll start this episode in which I will talk more about insurance in the country. For this I'll use these two reports. One is the annual report of the IRDA 2020-21, and the second report I'll be using is the National Family Health Survey 2019-20. I have given the references of both these reports in this slide, and I am sure if you search the net you will be able to download these reports. In the insurance domain, there are two parameters which are used to measure the efficacy of the insurance schemes. These are, first is insurance penetration and the second is insurance density. These two together can answer the questions like what is the percentage of people that are covered under insurance, what is the penetration of non-life insurance, life and non-life, and where do we stand as per the global standards. So let's look at the definitions of these two parameters. Insurance penetration is the percentage of insurance premium to the GDP, and insurance density is calculated as the ratio of the premium to the population of that country, which is also called the per capita premium. So I'll explain once again to make this very clear. The total insurance premium paid within a country by all the individuals, if you add them up and you divide it by the GDP of the country and take the percentage, that is known as insurance penetration. On the other hand, as I said, you add all the premium paid by all the people within a country and then divide it by the population, that is measured as the insurance density, and for a universal standard this is denoted in US dollars. I am sure all of you are aware of the two different types of insurances. The first is the life insurance, which all of us have taken from agencies such as the Life Insurance Corporation. The other is the non-life insurance, which we take in this non-life insurance. The major segment is health, then auto, travel, property, and other accident disaster insurances. I will first talk about the insurance penetration. Now I have data for the last 20 years from 2001 onward till 2020. If I plot that in a single graph, there will be too much clutter. So I am going to show you this data for a 10-year period. The first one is from 2001 to 2011. As I said, insurance penetration is the sum of the premium paid by all the people divided by the GDP. So it's a percentage of the GDP. Now in 2001, we started with a life insurance penetration of about 2.1%. Over the first 10 years, this figure rose gradually and came to around 4.5 by the end of 2011. On the other hand, non-life insurance was almost static. In fact, if we take in real terms and account for inflation, this figure would have gone down. We are less than 1% when it comes to non-life insurance. Now, the next 10 years from 2011 to 2021, the insurance penetration on health saw a decrease, and then again after 2018 or so there was a marginal increase. By the end of 2021, we were around 3.2%, which was even less than what we had started for in this decade. The non-life insurance, there is hardly anything to say about it. We still stand about 1%, which is miserably low, and as I said, health insurance forms a part of the non-life insurance, so you can well imagine where we are on health insurance. Now I'll give you a very interesting feel of this data. Why did the insurance, the penetration go down after 2014 or so? Here is the curve showing the total insurance, life plus non-life, for the last 20 years. So you will see that it was almost 3% till 2007. It started to rise, and then there was a peak by around 2011 at around 5%. Then it started coming down and went below around 3% in 2014. After that, there has been a steady increase, and today the total insurance stands at 4.2%. Now, just out of curiosity, I will superimpose the BSE Sensex, the stock exchange Sensex, on this graph, and the red line here shows the closing value of Bombay Stock Exchange Sensex for that particular year. In 2001, it was around 3000 points, and thereafter the Sensex has been growing steadily, and today we are close to around 60,000. And if you see the investment on insurance, it went up when the Sensex was hovering up less around 20,000 or less than 20,000. But as the Sensex started shooting up, the spend on insurance started coming down, which means that people got other options of investment such as the mutual funds or in equity. So they started diverting money to the stock market. Now that may be a good or a bad trend, but however, not having health insurance has its own challenges. Just see this kink at this place in 2020, when the penetration is suddenly going up, the index is going up and the penetration has gone up. This is the corona effect. Due to corona, a lot of people have realized the mistake they did and have started investing back in insurance, which is a rather good thing. Now I'll come to insurance density, which is the per capita spent on insurance within a country in US dollars. So here's the figure for India. The life and non-life are plotted separately. The total graph here is given in red, and today we stand at about $78 per capita in the country. 20 years ago it was a miserable $11. The trend was same. It peaked in 2011 and went up to $64, then came down, and again it's going up. Obviously you will like to know how does India compare with rest of the world. So here are the figures for the world. Now here on the left hand side I am showing the penetration chart. The blue bars are the world averages and the pink are the India specific data. On the right hand side I have shown the density. Now looking at penetration on life, we are not very bad off from the world average. We are marginally lower, but on the total, when it comes to including non-life such as health, we stand at about half of that the world average. Now when I talk of world, it includes the rich countries, the middle income countries and the poor countries. So this is not something which you should take very seriously, because this figure of the world is driven more by the lower income countries. The density, on the other hand, the amount of premium we spend, we are miserably lower than the world, almost at standing at 1/10 of the world average. And on non-life, which is health, we are nowhere, and this is the risk which we carry forward. I will show you some more figures right now. This is the same data of penetration and density for some country group of countries. Now first I'll look at advanced Asia. If you look at this, and India is at the bottom here, you will find that when compared to advanced Asia, we are still far behind. Look at the spend on insurance in these countries, $3,490. We stand at $78. US and Canada are the highest with over $7,000 per capita spent. Emerging Asia, which is countries like China, which come in that, even that there the spend on insurance is $215. So all these countries are way above India, and that is why India is right at the bottom of this chart. Now having said that, now I will come to the health insurance, and let's take a look where our states stand today. Now this is the health insurance graph, the percentage of population having a health insurance which is non-governmental. So these are all people who are in the private sector and who are not part of the government beneficiary schemes. India today has an average of 2%. That means only 2% people are covered under health insurance. Delhi comes on the top with 14% of its population covered. Gujarat at 7%. In fact, these green bars you see are all those states which are above 4%: Gujarat, Maharashtra, Kerala, Haryana and Goa. Then come the middle states, which are between 1 and 3%: Telangana, Tamil Nadu, Punjab, Karnataka, West Bengal, Uttarakhand. And the red bars are the low performing states, the usual suspect states of UP, Rajasthan, Odisha, Chhattisgarh, Madhya Pradesh, Assam, Andhra, all at 1% or lower. Then we have even lower Jharkhand, J&K, Himachal, and at the bottom stands Bihar at 0.2%. Now I will show you a snapshot of the National Family Health Survey 5 done in 1920 and compare it wherever data is available with the National Family Health Survey 4, which was done in 1516. Now here we talk of families. In the previous slide I was talking of individual, now we are talking of families. So households with any usual member covered under a health insurance scheme or financing scheme, private or government, that they have found out all over the country. Now I have taken some states for which I have compiled this data. I have compiled it for the capital city and 2 more districts far away from the capital, just to see whether the improvement or the degradation has happened only in the capital city or it has done uniformly across the state. Now Bihar, there is hardly any improvement in the last 5-6 years. If you see the capital, 9.4% were covered under the insurance, which has gone up to 10.2, marginal increase. In fact, some districts they have gone down as well. This is at the bottom of the list. Madhya Pradesh has been a medium performer. Rajasthan, on the other hand, has apparently done very well. It has grown from 28.9 in 2015 to 81 in 2021. Look at this district of Barmer. From 8.9 it is close to 100%. There has been excellent work to get people registered under a health insurance. Now these are families, remember. So one family, one member, that is what is counted. Uttar Pradesh, another state at the bottom of the pyramid, very little improvement. From 5.9, Lucknow has gone to 5.8, and similar increases you can see in other states. Banaras 8.3 to 12, Faizabad 6.6 to 19.8. We always say that hum mandir wahi banayenge. It would have been better, along with the temple, someone should have taken care of the health insurance of all the residents of these districts. I will just give you a bird's eye view of some of the other states. Chhattisgarh has done pretty well in the last 5 years. Kerala, which is on the top of the pyramid, but on health insurance, it is in the middle. Maharashtra, again a low performing state. Gujarat, low performing state. Tamil Nadu, medium performance, and Karnataka, again a low performing state. So many of the states who do well in terms of other parameters on family health insurance, they are still the laggards. Now I'll give you one more little data before I end today's session. This is the chart of rural versus urban, and you will be surprised to know that most of the states, the penetration of health insurance is more in the rural than in the urban areas. This is primarily because the government schemes which are there, they benefit the poor, and which are predominantly residing in the rural areas, whereas people in the city do not qualify for such schemes, and they have to depend on the private sector to get health insurance. So we are staying in a country where 40% of our population does not have health coverage. 7% of our population is pushed into poverty every year because of the high catastrophic expenditure they have to face, and more importantly, there is no product available to address the needs of the Indian market, and that is what is called the missing middle, people like you and me even if they want to take insurance, there is no suitable product. The government's apathy is very clear. They are neither pushing the non-life insurances, neither they seem to be bothered because the governments are preoccupied with other essential tasks. So that is all in this week's episode. I hope to see you again next week and we will discuss some other interesting topic. Till then, goodbye and namaskar.